Welcome back to MCQs Master 101. This is not a beginner cardiac review. These are Nclex level cardiac questions you are guaranteed to see on test day, built to test clinical judgment, prioritization, hemodynamics, and medication traps, not memorization. If you're looking for easy questions, this video is not for you. But if you're aiming for one-and-done Nclex success, stay locked in. Think like the test writer. Answer like a nurse who understands why, not just what. Let's begin. Question 1. A client with acute inferior wall myocardial infarction suddenly develops hypotension and clear lung sounds. Which complication is most likely? A. Left ventricular failure. B. Right ventricular infarction. C. Acute pulmonary edema. D. Papillary muscle rupture. Answer B. Right ventricular infarction. Inferior MIs commonly involve the right ventricle, causing decreased preload, hypotension, and clear lungs due to reduced pulmonary congestion. Question 2. A client with heart failure is receiving furosemide. Which lab value requires immediate provider notification? A. Sodium 134 milliequivalents per liter. B. Potassium 2.9 milliequivalents per liter. C. Chloride 99 milliequivalents per liter. D. Magnesium 1.8 milligrams per deciliter. Answer B. Potassium 2.9 milliequivalents per liter. Severe hypokalemia increases the risk of life-threatening dysrhythmias, especially in cardiac patients. Question 3. Which hemodynamic finding confirms cardiogenic shock? A. Decreased systemic vascular resistance. B. Increased cardiac output. C. Elevated pulmonary capillary wedge pressure. D. Low central venous pressure. Answer C. Elevated pulmonary capillary wedge pressure. Cardiogenic shock causes ventricular failure, leading to blood backing up into the lungs, increasing PCWP. Question 4. A client with atrial fibrillation is not anticoagulated. Which assessment finding suggests an embolic complication? A. Gradual onset dyspnea. B. Sudden unilateral weakness. C. Peripheral edema. D. Orthostatic hypotension. Answer B. Sudden unilateral weakness. Atrial fibrillation promotes clot formation that can embolize to cerebral circulation, causing sudden neurological deficits. Question 5. Which medication should be withheld in a client with acute decompensated heart failure and pulmonary edema? A. Morphine. B. Nitroglycerin. C. Metoprolol. D. Furosemide. Answer C. Metoprolol. Beta blockers decrease contractility and can worsen acute decompensated heart failure. Question 6. Which ECG change is expected with hyperkalemia? A. Prolonged QT interval. B. Peaked T waves. C. ST depression. Or D. Narrow QRS complexes. The answer is B. Peaked T waves. Elevated potassium alters cardiac repolarization, producing tall, peaked T waves. Question 7. A client develops chest pain 24 hours after MI that worsens with inspiration and improves when leaning forward. Which condition is suspected? A. Reinfarction. B. Pericarditis. C. Pulmonary embolism. Or D. Papillary muscle rupture. The answer is B. Pericarditis. Post-MI pericardial inflammation causes pleuritic chest pain relieved by leaning forward. Question 8. Which assessment finding is most concerning in a client with aortic stenosis? A. Bounding pulses. B. Syncope with exertion. C. Widened pulse pressure. Or D. Bradycardia at rest. The answer is B. Syncope with exertion. Aortic stenosis limits cardiac output during activity, leading to cerebral hypoperfusion and syncope. Question 9. Which medication increases preload and should be avoided in right ventricular infarction? A. Morphine, B. Nitroglycerin, C. Aspirin, or D. Heparin? The answer is B. Nitroglycerin. Nitroglycerin reduces preload, which can cause severe hypotension in right ventricular infarction. Question 10. A client with heart failure suddenly develops pink frothy sputum. Which intervention is priority? A. Obtain chest X-ray, B. Administer high-flow oxygen, C. Start IV fluids, or D. Place client supine? The answer is B. Administer high-flow oxygen. Pink frothy sputum indicates acute pulmonary edema requiring immediate oxygenation support. Question 11. Which finding differentiates stable angina from unstable angina? A. Pain relieved by rest, B. Pain radiating to left arm, C. ST depression on ECG, or D. Pain lasting longer than 20 minutes? The answer is A. Pain relieved by rest. Stable angina resolves with rest. Unstable angina persists and indicates acute coronary syndrome. Question 12. Which rhythm requires immediate defibrillation? A. Asystole, B. Ventricular fibrillation, C. Sinus bradycardia, or D. Atrial flutter? The answer is B. Ventricular fibrillation. VFib is a pulseless, chaotic rhythm requiring immediate defibrillation. Question 13. Which condition causes pulsus paradoxus? A. Hypertension, B. Cardiac tamponade, C. Mitral regurgitation, or D. Atrial fibrillation? The answer is B. Cardiac tamponade. Tamponade restricts ventricular filling, causing exaggerated drops in systolic BP during inspiration. Question 14. A client with mechanical valve replacement requires lifelong therapy with A. Aspirin, B. Clopidogrel, C. Warfarin, D. Heparin? Answer is C. Warfarin. Mechanical valves are highly thrombogenic, requiring long-term anticoagulation. Question 15. Which finding indicates digoxin toxicity? A. Hypertension, B. Yellow-green halos, C. Bradycardia with normal rhythm, D. Polyuria? Answer is B. Yellow-green halos. Visual disturbances are classic early signs of digoxin toxicity. Question 16. A client with acute pericarditis develops muffled heart sounds, hypotension, and JVD. What is occurring? A. Cardiogenic shock, B. Cardiac tamponade, C. Acute MI, D. Pulmonary embolism? Answer is B. Cardiac tamponade. Beck's triad, hypotension, JVD, muffled heart sounds, signals tamponade. Question 17. Which electrolyte imbalance increases digoxin toxicity risk? A. Hypernatremia, B. Hypercalcemia, C. Hypokalemia, D. Hypermagnesemia? Answer is C. Hypokalemia. Low potassium enhances digoxin binding, increasing toxicity risk. Question 18. Which intervention best reduces preload in acute heart failure? A. ACE inhibitors, B. Diuretics, C. Beta blockers, D. Calcium channel blockers? Answer is B. Diuretics. Diuretics reduce circulating volume, decreasing preload and pulmonary congestion. Question 19. Which dysrhythmia commonly follows inferior MI? A. Ventricular tachycardia. B. Atrial fibrillation. C. Sinus bradycardia. D. Complete heart block. Answer is C. Sinus bradycardia. Inferior MIs often affect the SA node via right coronary artery involvement. Question 20. Which finding indicates left-sided heart failure? A. Hepatomegaly. B. Peripheral edema. C. Crackles in lungs. D. Jugular venous distension. Answer is C. Crackles in lungs. Left-sided failure causes pulmonary congestion due to impaired ventricular ejection. Question 21. A client with unstable angina receives nitroglycerin with no relief. What is the next priority? A. Administer morphine. B. Obtain troponin levels. C. Prepare for PCI. D. Repeat nitroglycerin. Answer A. Administer morphine. Morphine reduces pain, preload, and sympathetic response when nitroglycerin fails. Question 22. Which ECG change indicates acute myocardial injury? A. Q waves. B. ST elevation. C. T wave inversion. D. Prolonged PR interval. Answer B. ST elevation. ST elevation reflects acute myocardial injury and ischemia. Question 23. Which medication improves survival in chronic heart failure? A. Furosemide. B. Digoxin. C. ACE inhibitors. D. Nitrates. Answer C. ACE inhibitors. ACE inhibitors reduce remodeling and mortality in heart failure. Question 24. Which finding suggests acute mitral valve regurgitation post-MI? A. Gradual dyspnea. B. Sudden pulmonary edema. C. Bradycardia. D. Hypertension. Answer B. Sudden pulmonary edema. Papillary muscle rupture leads to acute mitral regurgitation and rapid pulmonary congestion. Question 25. Which action is contraindicated in cardiogenic shock? A. Vasopressors. B. Inotropes. C. Large IV fluid bolus. D. Oxygen therapy. Answer C. Large IV fluid bolus. Excess fluids worsen pulmonary congestion and ventricular overload. Question 26. Which drug decreases afterload? A. Furosemide. B. Nitroprusside. C. Digoxin. D. Dopamine. Answer B. Nitroprusside. Nitroprusside causes arterial vasodilation, reducing afterload. Question 27. Which symptom is most specific to heart failure exacerbation? A. Weight gain of 2 kilograms in 48 hours. B. Fatigue. C. Anorexia. D. Headache. Answer A. Rapid weight gain reflects fluid retention and worsening heart failure. Question 28. Which finding confirms effective reperfusion therapy after MI? A. Persistent chest pain. B. Decreasing troponin levels. C. Resolution of ST elevation. D. New Q waves. Answer C. Resolution of ST elevation. ST segment normalization indicates restored coronary blood flow. Question 29. Which client is at highest risk for infective endocarditis? A. Mitral valve prolapse. B. Prosthetic heart valve. C. Controlled hypertension. D. Stable angina. Answer B. Prosthetic heart valve. Foreign material increases bacterial adherence risk. Question 30. Which assessment finding suggests worsening cardiomyopathy? A. Increased ejection fraction. B. Decreased BNP levels. C. Rising creatinine. D. Improved exercise tolerance. Answer: C. Rising creatinine. Reduced cardiac output impairs renal perfusion, elevating creatinine. Question 31. Which medication prevents ventricular remodeling post-MI? A. Beta blockers. B. Calcium channel blockers. C. Loop diuretics. D. Antiarrhythmics. Answer: A. Beta blockers. They reduce myocardial workload and adverse ventricular remodeling. Question 32. Which condition causes widened pulse pressure? A. Aortic regurgitation. B. Mitral stenosis. C. Cardiac tamponade. D. Pulmonary hypertension. Answer: A. Aortic regurgitation. Backflow into the ventricle increases systolic and lowers diastolic pressure. Question 33. Which rhythm is most associated with sudden cardiac death? A. Atrial fibrillation. B. Ventricular tachycardia. C. Sinus tachycardia. D. First-degree AV block. Answer: B. Ventricular tachycardia. VT can rapidly deteriorate into ventricular fibrillation. Question 34. Which lab value best reflects heart failure severity? A. Troponin. B. CKMB. C. BNP. D. CRP. Answer: C. BNP. BNP increases with ventricular stretch and volume overload. Question 35. Which pliant should the nurse see first? A. Stable angina with pain 2/10. B. Heart failure with weight gain. C. Post-MI client with new S3. D. Atrial fibrillation with HR160. Answer: D. Atrial fibrillation with HR160. Uncontrolled rapid AF can severely reduce cardiac output and requires immediate intervention. Question 36. Which medication is contraindicated in severe aortic stenosis? A. Diuretics. B. ACE inhibitors. C. Nitrates. D. Beta blockers. Answer: C. Nitrates. Nitrates reduce preload, risking severe hypotension in fixed outflow obstruction. Question 37. Which finding indicates electrical alternance? A. Irregular P waves. B. Varying QRS amplitude. C. Prolonged QT. D. ST depression. Answer: B. Varying QRS amplitude. Electrical alternance suggests cardiac tamponade. Question 38. Which position improves oxygenation in heart failure? A. Supine. B. Prone. C. High Fowler's. D. Trendelenburg. Answer: C. High Fowler's. Upright positioning reduces venous return and pulmonary congestion. Question 39. Which complication is expected 5 to 10 days post-MI? A. Ventricular septal rupture. B. Dressler syndrome. C. Reinfarction. D. Papillary muscle rupture. Answer: A. Ventricular septal rupture. Mechanical complications such as ventricular septal rupture occur 3 to 10 days post-MI due to myocardial wall necrosis and weakening. Dressler syndrome is an autoimmune pericarditis that typically occurs weeks to months after MI, not within 5 to 10 days. Question 40. Which drug improves contractility without increasing heart rate? A. Dopamine. B. Dobutamine. C. Digoxin. D. Epinephrine. Answer: C. Digoxin. Digoxin increases myocardial contractility while slowing AV conduction. Question 41. Which finding indicates acute left ventricular failure? A. Ascites. B. Peripheral edema.
C. Crackles and orthopnea. D. Jugular venous distension. Answer: C. Crackles and orthopnea. Pulmonary congestion defines left ventricular failure. Question 42. Which rhythm shows absent P waves and irregularly irregular rhythm? A. Atrial flutter. B. Atrial fibrillation. C. Ventricular tachycardia. D. Junctional rhythm. Answer: B. Atrial fibrillation. Chaotic atrial activity eliminates organized P waves. Question 43. Which client is most likely to develop cardiogenic shock? A. NSTEMI patient. B. Inferior wall MI. C. Extensive anterior MI. D. Stable angina. Answer: C. Extensive anterior MI. Large anterior infarcts impair left ventricular function significantly. Question 44. Which medication reduces mortality post-MI? A. Aspirin. B. Beta blockers. C. Calcium channel blockers. D. Nitrates. Answer: B. Beta blockers. They reduce arrhythmias, myocardial oxygen demand, and mortality.
Question 45. Which symptom suggests acute aortic dissection? A. Gradual chest tightness. B. Sharp tearing chest pain. C. Epigastric discomfort. D. Exertional dyspnea. Answer: B. Sharp tearing chest pain. Aortic dissection classically causes sudden, severe tearing pain. Question 46. Which ECG change indicates myocardial necrosis? A. ST elevation. B. T-wave inversion. C. Pathologic Q waves. D. Prolonged QT. Answer: C. Pathologic Q waves. Q waves represent irreversible myocardial cell death. Question 47. Which medication is first line for acute SVT? A. Amiodarone. B. Adenosine. C. Lidocaine. D. Atropine. Answer: B. Adenosine. Adenosine temporarily blocks AV conduction to terminate SVT. Question 48. Which condition causes decreased ejection fraction? A. Diastolic heart failure. B. Systolic heart failure. C. Constrictive pericarditis. D. Pulmonary hypertension. Answer: B. Systolic heart failure. Impaired contractility leads to reduced ejection fraction. Question 49. Which finding indicates worsening tamponade? A. Hypertension. B. Narrow pulse pressure. C. Bradycardia. D. Loud heart sounds. Answer: B. Narrow pulse pressure. Tamponade reduces ventricular filling, narrowing pulse pressure. Question 50. Which action prevents ventricular arrhythmias post-MI? A. Early ambulation. B. Potassium replacement. C. Fluid restriction. D. Morphine. Answer: B. Potassium replacement. Maintaining normal electrolytes prevents lethal ventricular dysrhythmias. If these questions made you pause, that's a good sign. That's how the real Nclex feels. Go back, review the rationales, and ask yourself, why is this correct, and why are the others dangerous? If you want next-gen Nclex, case-based questions, and elite-level practice, subscribe to MCQs Master 101 and turn on notifications. Train smart, think critically, and walk into your Nclex ready to pass. I'll see you in the next mastery session.